Paroxysmal atrial fibrillation is the type of atrial fibrillation that comes and goes and never lasts for more than 7 days. But persistent atrial fibrillation, which is the bulk of people with atrial fibrillation, goes on for at least 7 days in duration without interruption, or requires a shock to the heart to convert it back to normal rhythm. So typically the conversation regarding the treatment of persistent atrial fibrillation focuses on the fact that we really don't have the adequate tools necessary to address the problem. So in order to address the problem, we use tools that are really designed for paroxysmal atrial fibrillation to fix the persistent atrial fibrillation. And the success rate using that same tool set is moderate at best. So we're looking at 50% success rates with the first procedure. Whereas with paroxysmal AFib ablation, we see success rates now with recent clinical trials over 80%. So there's this really significant gap between the success rates when addressing the two problems. So every heart has the equivalent of the appendix on it, this structure that's physiologically seemingly unimportant, but is the source of thrombi that result in strokes from atrial fibrillation, and is also the source of some people's persistent atrial fibrillation. So we literally tie it off and the structure completely disappears. And when it disappears and it's no longer functioning, we think that reduces or will likely reduce the amount of atrial fibrillation someone has and help with curing the atrial fibrillation, as well as ideally eliminate that area as a source of stroke or thromboembolism. Any one of those patients that has persistent atrial fibrillation, the first thing I do when I see them is think about, are they potentially a candidate for the aMAZE trial? Because if I want to give that patient the best possible chance of success, I offer them the ability to enroll in the aMAZE trial as long as they meet the inclusion and exclusion criteria. We're so stringent, we really want to select for the right patient. So we see tons of patients that have persistent atrial fibrillation, and ultimately, we have to find the right patient, the right match for the trial, so that scientifically the study is sound. So in the end, we can ultimately offer this procedure to everyone with persistent atrial fibrillation. So at this stage, we're really trying to limit it to the right patients that fit the mold for the trial, in the hopes that eventually we'll expand to offer this as an option for everyone with persistent atrial fibrillation. So far, my experience has been people who undergo this procedure with this strategy have done exceptionally well. So I've been amazed with the aMAZE trial so far.